Welcome to Chapter 24, Hematology and Nephrology. Hematology is a medical specialty concerned with blood disorders, and nephrology is concerned with renal and kidney disease. We're going to talk about some problems associated with both of these topics. Each component of the blood has a specific function which is crucial to the patient's health and survival. We need to look at control of bleeding by clotting, delivery of oxygen to the cells, and removal of carbon dioxide from the cells. Blood is made up of solid components suspended in a liquid called plasma. Red blood cells, your RBCs, contain a specialized molecule called hemoglobin, and that binds to oxygen, and that's responsible for the oxygen delivery to the cells. Your white blood cells respond to infection, and they're the mediators of the body's immune system. So if a patient goes in and they have a low white blood cell count, that tells you they're going to have a hard time fighting infection. Platelets are fragments of larger cells that are crucial to the formation of clots. For example, if a coronary artery ruptures, the rapid clumping of platelets causes a clot that can completely block the coronary artery and result in a heart attack. Clumping of platelets in the body is the most rapid and initial response to stop bleeding. Plasma contains dissolved nutrients and carries certain crucial proteins such as clotting factors. Clotting factors are that group of proteins that are produced in the liver and released into the bloodstream. Clotting factors circulate in the bloodstream in inactive forms, but are activated to initiate clotting when damage occurs to the lining of a damaged blood vessel. Once activated, clotting factors form clots through specific steps that are described as clotting cascades. Anemia is a lack of normal number of red blood cells. Acute anemia might be a result of a trauma or a sudden massive bleed. Chronic anemia occurs over time and can be caused by conditions such as a heavy menstrual period, slow gastrointestinal blood loss, or diseases that affect the bone marrow or structure of the hemoglobin molecule. Sickle cell anemia. I wish I could be with you face to face because I'm very passionate about this. These patients experience extreme pain, and this is a very real, painful disease. Sickle cell is an inherited disease in which patients have a genetic defect in their hemoglobin that results in an abnormal structure of the red blood cell. And you can see that off to the right on the screen. Most common in patients of African American descent, but they can also occur in patients of Middle Eastern or Indian descent. A normal red blood cell, as you can see on the left, looks like a donut shape with a little depression in the center. It's not really a hole, there's just a little depression there. And it has the ability to compress as it moves and squeezes through small capillaries to deliver oxygen to the cells of the body's organs. Patients with sickle cell disease have red blood cells with an abnormal shape, and as these pass through those same blood vessels, it's causing the patient significant pain. A common shape of these abnormal red blood cells resembles a sickle, and that's why it's called sickle cell anemia. Because of the abnormal shape, the red blood cells do not survive in circulation as long as normal red blood cells do, leading to anemia. Some complications of sickle cell anemia are destruction of the spleen, sickle cell pain crisis, acute chest syndrome, priapism, stroke, jaundice. Patients who have sickle cell usually have an abnormally short lifespan. Emergency care for this patient with sickle cell should absolutely include oxygen and pain management. Hi guys, it's Lisa in the middle of your PowerPoint. I just wanted to share a story with you about sickle cell anemia. When I was in paramedic school, I did a clinical rotation at Trinity Hospital. I had a young girl who came in just screaming and thrashing around in pain. The staff from the hospital was not very sympathetic to her, which I can't speak of that, but what I will tell you is that the staff said there's no way this poor girl could be in so much pain. I didn't really understand. I was a student. I was still trying to learn things, but this young girl was actually just wincing and crying and screaming to put her out of her misery because she was in so much pain from sickle cell. As it went on and I saw it more and more in other people and I understood the disease a little bit more, it is easy to understand how somebody could be in that much pain. Our sickle cell anemia patients absolutely must get oxygen. They need IV fluids. Any patient with a high fever should be checked for hypoperfusion, and they should be treated for shock if necessary. Transport these patients in position of comfort, and please be very sympathetic to them because this is a very real pain. Hemophilia is a deficiency of clotting factor. So you're going to have a patient with excessive bleeding, but it may not be bleeding that you can see. They can have blood in their urine, they might have blood in their stool. You might notice some really, really deep bruises. Obviously the picture that you're seeing is kind of a classic. What we expect is to see that kind of excessive bleeding. They can have bleeding gums, they may have frequent nosebleeds, they might have pain in their joints. So there's a variety of different ways that this patient might present. I'm back in your video again. I just want to talk real quick about hemoarthrosis. So if you don't know what it is, again, I'm going to ask you to break up the words. You know that hemo is blood. If you thought of something arthrosis, maybe if you look at it, it kind of might remind you of arthritis. And where would arthritis be? Arthritis would be in the joints. So if you put blood and joints together, it's actually blood in the joints. So the way that we would control that in terms of our pain management, and really right now that's what their problem is pain for what we can take care of. Might want to put some ice packs on there to help slow some of that bleeding and that pain. In terms of hemophilia in general, pre-hospital, we're going to just manage whatever blood we can see. Any bleeding that we see, we're going to control that bleeding. Okay, so let's jump to the urinary system. The urinary system is made up of four major structures: the two kidneys, the ureters, the urinary bladder, and then the urethra. Dialysis. Patients are going to require dialysis when they are in renal failure. And what renal failure means is that they're in kidney failure. So the kidneys have lost the ability to remove the waste and balance the fluids. This is usually a chronic problem, so it happens over time and they deteriorate to this point. This may be somebody who is a diabetic that hasn't managed their diabetes well, so they've ended up in this position. But there can also be acute renal failure that could be a result of maybe shock or some toxic ingestion. Patients who go into irreversible renal failure are described as patients that have end-stage renal disease, and you'll see that abbreviated as ESRD. And dialysis is really just the process of that external machine removing the waste that the kidneys can't. So it's going to remove the toxins and the excess fluid that the body can't. Anybody who's under dialysis is also going to be very, very careful with their fluid intake because they don't want too much fluid because their body's already having a difficult time maintaining that balance. So we actually can continue from there. Hemodialysis, about 90% of our end-stage patients get into this specialized outpatient dialysis center. And what happens is the patient is connected to a dialysis machine that pumps the blood through specialized filters to remove the toxins and the excess fluid. So the patient is connected to the machine with two large catheters. One catheter allows the blood to flow out of the body into the dialysis machine, and then the other catheter is going to return the blood to the body after the filtration. So you can have hemodialysis done in the hospital, at a dialysis treatment center, or at home. If you have it in a center, the session usually lasts about 3 to 5 hours, and you likely only need that about 3 times a week. However, you can have it at home, so you might need it a little bit more often. You might need it 6 or 7 times a week, and then that would only last for about 2 or 3 hours each day, but you might be able to do that while you're sleeping. So this is actually very easy when you think about it. What are the effects of missing a dialysis treatment? So if you think about that the toxins are building up in your body, the toxin levels are going to get higher and higher if you don't eliminate the toxins. So you're going to end up ultimately getting worse and worse. You're going to feel tired, you're going to feel weak, and then it's just going to progress from there. When these toxins build up, it increases your risk for cardiovascular disease. You're going to note a loss of energy. You're going to notice a change in your muscles. Your mental status will change along with some abnormal sensations like maybe burning feet. You'll have skin changes, appetite changes, weight changes. There are reasons why you might skip a dialysis treatment. Certainly, just scheduling issues can be a problem. You wouldn't want to make a habit of it, but if it happened once in a while. But also, it's might be a reason to skip a dialysis or flip-flop days if you have excessive vomiting or diarrhea, so you're losing fluid that way. So our pre-hospital care is basically going to be supportive. We're going to make sure that we assess our ABCs. We're going to make sure we get a couple good sets of vitals. We're going to check a pulse ox and make sure that our patient is on O2. We're going to have our patient in a position of comfort. Please make sure that you have the AED ready and look for things, be prepared for things maybe such as seizures. So kidney stones. Kidney stones are incredibly painful. Kidney stones are usually made up of calcium, and they're formed within the kidney, which is okay. We got a nice big space there, and we have a little pebble. As long as they remain in the kidney, we'll be okay, and we'll have no symptoms. We'll have no problems. Problem is that when that kidney stone starts to move, you're going to start experiencing pain. So something as simple as a little rock in your shoe. You're walking and you feel that in your shoe. You take your shoe off, you look and you see a little pebble. How could such a little pebble cause so much pain to your foot? Well, think of that same little pebble in your kidney. Nice big area, but now as it starts going into the tubes and going into a smaller area, it's going to cause pain. Our patient will present in significant pain. They will may have a history of kidney stones. They may have a family history of kidney stones. And what we're going to do pre-hospital, we're going to make sure that we are position of comfort and supportive care. So you're going to see here that obviously kidney stones are more common in men than in women. If dad has them, the son will probably have them as well. These are going to vary in size, but even the tiniest of kidney stones can cause very significant pain. If a patient passes them on their own, they may not even be aware that they've had a kidney stone, but it's when the patient is experiencing significant pain that then it's going to have to be investigated how to clear the stone from the patient. We'll start with just filtering their urine, so they'll see if they've passed the stone on their own. If not, they may want to scan the patient to see where the stone is actually sitting, but ultimately they can dissolve it with some ultrasonic ways, or they can actually go in and scoop it out depending on the location of the stone. And once a stone producer, always a stone producer. So if they've had stones in the past, it's possible that they'll have stones again. So make sure you're getting an accurate history of your patient. So ladies, you're not getting out of it so easy. While the men may have kidney stones, be more likely to have kidney stones, women are more likely to get UTIs, urinary tract infections. Again, they're going to complain about abdominal pain, frequent urination, painful urination, and this can start in little girls too. A urinary catheter is a drainage tube that's placed in the urinary system to allow the flow of urine out of the body. These patients have a difficult time urinating, so that's the point of the bag itself. Patients can function with the bag. You as an EMT, make sure that you're keeping the bag below the level of the bladder so there's no backflow into the patient causing an infection. If you can imagine it, there's actually a bulb that is blown up on the catheter once it's inserted. And this can be a problem for men, especially older men, when that catheter is strapped to their leg and they feel the tubing. Middle of the night, the patient rolls over, they feel something on their leg, they grab their tube and they pull, which means they're pulling their catheter out in the middle of the night. But remember, that bulb is inflated, and as they're pulling it out, it's going to cause pain and trauma. The kidney is the most transplanted organ.